Welcome again, and as Kathy said, my name's Emily Rice and I'm based with 9 News at the moment. And I'm your host for this very timely Melbourne Press Club discussion on media and health literacy. Now, the aim of the webinar is twofold. We want to help medical professionals better understand how to use the media to disseminate their messages, and we also want to help media professionals better comprehend and convey these health messages to the public, and hopefully we can all better work together. As Kathy mentioned, I've been a reporter. It's actually 22 years now, and after a long interest in health, I was appointed 9 News Melbourne's medical reporter. I think it was 2016. It seems a million years ago now. Now, health news was already at that time starting to evolve. It was seen as the soft sort of news at the end of the bulletin, but it was becoming more prominent. And my stories in particular were less about breakthroughs and miracle cures, and I was trying to focus a lot more on conveying public health messages, whether it be about the terrible influenza season of 2019 or a public health campaign to improve the diets of tradies. And of course, helping us every step of the way are some brilliant and tireless public health experts who, in addition to their day jobs, they actually do have day jobs, they don't just talk to the media, they're always available to give advice and an independent explanation of what's going on, a non-partisan explanation. And shortly we're going to hear from some of the best. Professor Nancy Baxter, Professor Tony Blakely and Damian Ferrie. First of all, let's hear from Professor Nancy Baxter. She's the head of Melbourne's School of Population and Global Health at the University of Melbourne. I'm sure you've seen her before. Please welcome Nancy Baxter.
In getting ready for this, I looked up some stats, and up to 60% of Australians lack health literacy. So they lack the sufficient kind of knowledge to be able to access and understand health information in ways that will benefit their health. And this is a global phenomenon, and it's a global threat to human health in terms of people not being able to access the information they need for their healthcare. We know that people with low health literacy are at risk of worse outcomes, both at the individual level, but also at a collective level. So we have health literacy, and then we have health journalism. And obviously the news is about news. It's about giving people information they need to make decisions about their lives and about society, information that's important, it's interesting, and it's informative and influential. And then there's also verification. So with health journalism, they're supposed to be producing a verifiable functional truth that people can actually use. It may be truth that's modified, it may develop, but it's a functional truth that's verifiable. And there's always been a somewhat fraught relationship between health journalists, journalists in general, and scientists and experts, as well as the public. Because what's newsworthy isn't necessarily, the journalists are not public servants. They're not there to promote a certain governmental policy. They're not there to be the effector arm of the healthcare system. They're there to inform the public, but they're there to make news. So there's always been a somewhat fraught relationship, and sometimes it can be somewhat sensationalistic. So these are all issues that we've had in the past, but then we now have COVID. And actually this relationship between experts and scientists, the public and journalists has become, in reality, existential. It's been critical to our existence and to our ability to control this pandemic. We have a need for people to acquire and apply health information and adapt their behaviors in really exceptional ways incredibly quickly. And at the same time, they need to deal with, pretty complex, conflicting, and even misinformation that's out there. And really the only way we've been able to achieve this is by, excellent, committed, and very contemporary journalism. We know that people with low health literacy have had more problems understanding and complying with rules and restrictions with COVID. They have they haven't understood as well what the symptoms of COVID are or what behaviors they need to do to protect themselves and their family. And this is irrespective of what language they speak. This is not just a non-native English speaker problem. And it's a challenge. This is a challenge for health educators. It's a challenge for scientists and experts, and it's a challenge for journalism. Because as I said, they're not the media arm of the government. They're responsible for producing news that's informative, but it's also interesting and important. And so that can sometimes conflict with the need to get across a certain message from the government. And I think that there's a tension there that I think we're going to talk about more today, and I'll be really interested to hear what the other panelists say. We also know that people with low health literacy are also more likely to endorse misinformation. So they're more likely to believe misinformation about COVID and vaccination. We know there's always been misinformation, rumors, conspiracy theories. That's almost since time immemorial, with human beings trying to make sense of their lives in whatever way they can. But now this has really been amplified. It's called an infodemic, and the misinformation is able to travel further and faster with people who are able to really be very convincing because they're not held to this functional truth. They don't need to produce a functional truth. They just need to produce something that's compelling. And so the need to counter that is even more urgent. And so there's a really key role of traditional media to work with experts and scientists to really be able to provide this evidence-based information. So it's really, the pandemic has really heightened the role and responsibility of journalists in a way that I think must be at times crushing.
Our next speaker is Tony Blakely, an epidemiologist and director of the Population Interventions Unit within the Centre for Epidemiology and Biostatistics at Melbourne University.
I'm just going to make a few comments and then I'm going to finish up at the end with a conundrum that I'm thinking about at the moment as an example of trade-offs. I'm going to start with a chap called Tudor Hart. In 1971, he came up with this theory or hypothesis called the inverse care law. That's the idea that the people who let's do it the other way around. The people who least need medical care get it the most. So the people who have the lowest risk of coronary heart disease end up being the most likely to get treatments like angioplasty and heart surgery and all the rest of it. And that plays into the concept of inequalities. And I also wonder if there's a parallel, more than wonder, I think it's fair to say there probably is a parallel with what we might call the inverse media law. And Nancy's already mentioned that, whereby the information that needs to get out most in this pandemic is to marginalised communities, which the COVID virus loves going to and spreading in. And I'm not sure that we've done that particularly well. Some of my colleagues will only want to talk to highbrow left-wing Guardian and ABC types. I don't think that's particularly helpful when you want to reach across the whole population with better insights. And so it's very important for experts like ourselves to cut across the whole media chain, but I don't feel as though we've reached as well as we can into communities culturally and linguistically diverse, the inner western suburbs of both Melbourne and Sydney, for example. And that's something that bothers me about how we could have done this better. On things that have gone well, I think, with the media, is that we have got some pretty extraordinary public understanding of sociological phenomena. So, for example, the concept of herd immunity, that what you do individually isn't just for your own benefit, but spills over, and how we communicate that as a spillover or a herd immunity effect. I think we've done pretty well on that front. I found earlier in this pandemic, when I was being asked to do media, I was often asked to be like the weather forecaster. Please come on our show, Professor Blakely, and comment on what's happened in the last 24 hours and what you think might happen in the next 24 hours. I don't think that's the best use of academics in this pandemic. I think we're better at trying to provide that analysis, those tools that allow citizens to have a longer term understanding of what might be going to happen in the future, as well as information for themselves to help making decisions. Right, I want to finish up on my conundrum. And this is about trade-offs, which has elements of ethics and equity. And what I think, as you probably have seen me on media, I always like drawing diagrams in the air, so I'm going to finish up doing that. I think we've got a really interesting issue coming up in the next month to 2 months. So our rates are going up like this in Victoria. They're already further up in New South Wales. And they could probably go up. We could probably cope with 1,500 cases per day at a peak before it comes down when the vaccination coverage catches it. Now, we're going to have to make some choices soon. Hopefully, we can keep that rate less than that. But then what are we going to do? What are the things that we're going to let ourselves do that will fan, that will give oxygen to the transmission? And the most obvious one is schools. We're going to want to open those schools in early October. And that will without doubt, fan transmission, but hopefully we can do it within the headroom that we've got left before the health services get overrun. But it might be that the bars and the restaurants want to have a bit of trade. It might be that people want to get back to work. And we're going to have these trade-offs, these discussions we need to have as a society, which I think is going to be an interesting domain, not only for epidemiologists to speak to, but also bringing in ethicists, philosophers, people interested in equity perspective, businesses, schools, as to what do we actually give ourselves back as the vaccination coverage increases first to keep ourselves within the headroom of not going above 1,500 cases.
I'd like to introduce Damian Ferrie. He's the CEO of Star Health, which serves vulnerable populations in Melbourne's inner south and Bayside. He also chairs the Victorian Council of Social Services and Mental Health Victoria. Thank you very much for your time, Damian.
Thanks very much, Emily. And what a great introduction and two great speeches. During the pandemic, Community Health and Star Health, along with a broad network of community health services, have really been engaging with what we've been calling priority population groups. So people that sit within that sort of space that Nancy and Tony both spoke about. And this broadly within the health sector, we talk about, the social determinants of health, things like education, income, employment, housing, all influence people's health outcomes. And as has already been alluded to, it is very clear that COVID can grow in areas where there is where all those issues are present and really lead to both disadvantage and ensuring that people don't have access to both information and the services that they may need. In preparation for this event, I decided to ask some of the Star Health staff who have been working in what we know as the older persons high-rise public housing towers in and around St Kilda and Prahran. And I just thought I would share with you very quickly. It's a bit of a pulse survey. It's not particularly scientific, so apologies to the academics. Notably, I am the person who's not the academic here, but some of their insights was different, was interesting. And I think for many of the journalists that might be listening to this, for me, was both surprising and heartening for the reasons that Nancy indicated that, one would expect literacy and knowledge of what was around perhaps not to be as developed as it could be. So to the question, where do you get your news from? Unsurprisingly, the majority of people, 80%, got it from the TV. And really interestingly, less than 20% got information from social media. And this plays out interestingly when I ask the next question. Can you tell us how the news helped you to know what to do around COVID and vaccination? Response, a sample. It kept me up to date on exposure sites and where to get tested if I needed to be. Although it scared me, I was already going to get vaccinated and I'm now vaccinated. Staying up to date on cases of COVID, restrictions where hotspots are, such as South Melbourne Market and the cafe that were Tier 1 and Tier 2, wearing masks, the 1 metre rule distance, antibacterial solutions, and so on really helped me. So interestingly, there wasn't a lot of negativity in the response we got from these communities. And in a certain sense, I expected it to be. To response to the question, can you tell us how the news influenced your decision on vaccination? And bear in mind that in these high rises, above 80% of people have been vaccinated already. A number of people said things like, I got vaccinated because it was survival instinct. Another response, as a senior citizen who keeps informed, I could not help but be influenced by what I consider as intelligent and reliable news sources. So take a bow. The decision was clear to me to get vaccinated or die. Another person said, though, I have not yet been vaccinated. I am hesitant. The news has not really provided me with adequate information about mRNA vaccines and their potential risks. Most of the media was about the side effects of AZ. And just finally, and there's lots of information here, but just finally, any other comments about the news relating to COVID? I think it's overdone now. I'm over it. Another comment. I do not appreciate the rhetoric in the media shaming people who are afraid of vaccines and may choose not to be vaccinated. Another comment, I found coverage by all media outlets, including radio and TV, very negative, highly politicised and not very helpful. So just concluding with, I suppose, some optimistic, I think there's a lot of optimism in those comments, and I think those in the media should be quite pleased that, you know, these vulnerable population groups that our organisation works with are giving very clear indication of the fact that they have appreciated the information and it's been clear to them.
The other interesting point I thought you made, Damian, is shame, because and I think Nancy and Tony can talk to this as well. There is, you know, there's anti-vax and there's vaccine hesitation, and I think we do have to tread a fine line between telling people they have to get it and also shaming people that have questions, because there's nothing wrong with having questions. In fact, that is a mark of someone who is health and media literate, that they can ask questions and want to know more. Do you have any advice on how to report on complex messaging and calls to action for an event like this pandemic?
Oh, look, none of us are brilliant at this. Complexity. I'm often accused by my colleagues, including right today, my team actually, about writing too complex a report. But somehow when you're in the media, you've got to jump beyond that. And I do think metaphors work really well. And I do think the bushfire metaphor works very well for pandemics. So, for example, the suburbs I was talking about before, they are like the really dry part of the bush. And if you don't do forest control in those, they're going to catch fire first and they'll take down the rest of the fire. That's that rest of the bush. So that's that sort of enlightened self-interest to go in there and look after that area well. So as far as dealing with complexity, I spend quite a lot of time. I'm not sure about Nancy, but as I'm standing out on my verge every morning about to do morning TV, or I'm waiting for the media, I'm always thinking, what metaphor can I use here for this complexity? So to the chagrin of my partner, who's sitting just over there, I've used Kermit the Frog at various times, Harry Potter and the invisibility cloak, all sorts of metaphors, trying to think of ways of communicating things better. And coming back to the inverse media law, it would be quite useful for us academics to be getting some of these types of metaphors and knowing what does work in marginalised communities and what doesn't, because our job is to try and think of ways of bridging across and communicating these messages. So hopefully that gives a little bit of a comment there, Emily.
What advice could you impart to someone who wants to speak to the media but is just frightened about the backlash, maybe professionally or personally?
Yeah, well, I must say that, when I initially started interacting with the media, there wasn't a ton of backlash because, I wasn't prominent. It's only as I become more well-known that you start getting some emails that aren't necessarily polite, shall we say. But I think you're always safe if you're talking about your own truth and your own narrative. So I think if you're an emergency doc and you're concerned about what's happening, you're feeling overwhelmed, there's something you want to convey in terms of, COVID symptoms like headache being prominent, something like that, speak your truth. Speak something that relates to, a story about what has been happening to you and what you've seen. Obviously, you have to protect patient confidentiality, but I think everyone reacts to that very, very well, and not in a way that's as prone to having you personally attacked. If you're basically just saying, this is my reality and I need you to hear my reality.
All journalists understand the phrase, this is off record. So you can always talk to them. I have not had one journalist that I'm aware of who has taken anything to the media or broadcast it that I've said is off the record. And that off the record stuff could be just sharing your concerns and asking for advice on how to talk about something. It could be also that you want to talk about some information that you're not ready to talk about in the public yet. That a big bouquet to the media this time around. I have not had any problem with any journalist about off the record comments. And if I say something and then I realise that I'm not comfortable with that being said, I can say, could you please just not mention that? They have been fantastic.
We've got a question from Alan Fells, and I think I will start with you on Damian on this, because you did touch on this. If you can just touch on this as well. How well was the AstraZeneca scare handled?
Well, it scared a lot of people. The people we deal with were really scared. And the typical response when we set up our first pop-up clinic for elderly people, the first thing of those, we literally set up in the community room in the foyer, kind of a high rise. People said, we're waiting. And we're not sure what they were waiting for. They were waiting to see whether actually, we think, whether friends and family were going to be vaccinated and whether they'd be okay. And interesting, and this is a theme that I know population health people talk about a lot, when more and more people do something, it gives kind of this authorising environment for more people to do it. So I think it was pretty damaging, actually. And, it is a personal view. I think it's something that we will regret in future, that as a public health message, that a really good vaccine, people don't want it.
Could it have been better handled, or was it just the circumstance of what occurred in terms of the way ATAGI was dealing with it at the time?
Well, I think a few things. One is that AstraZeneca already had detractors because of differences in effectiveness. So it's not like it was the most effective vaccine and had these side effects. It's unfortunate, slightly less effective in terms of any infection, very effective in terms of hospitalization, ICU, all that kind of stuff, but slightly less effective in terms of any infection. So already had that kind of baggage, and then went into having issues with TTS. Now, I do think that there's been some sensationalistic journalism. I mean, I've seen some front pages of papers where, it is going way too far in terms of how they've reported deaths from AstraZeneca. And you do notice a real difference between, the death in New Zealand from myocarditis related to Pfizer, and there seems to be a distinct difference in terms of how those were reported. But one thing I would say is, worldwide, there were restrictions in terms of recommendations for AstraZeneca. This is not something that's unique to Australia.
Never before in modern history of medicine have I think we've focused so much on one medication, one vaccine in this instance, and its benefits and risks. But this issue applies just about everything we do in medicine anyway. So maybe one of the lessons we get out of this is that, we can try and communicate those things better in the future.
Have you been asked on any podcasts, Nancy?
I've done a couple of podcasts, but they edited me. I like live. I like the kind of on your edge kind of, but also that you control your message. And you can do that. I've found on even on television, often they'll give you a little bit more time than you usually get on TV because people are really interested in the story and the reporters and producers understand it's complicated. So often you get a little bit more time than you ordinarily would. But I do find sometimes you need to control the narrative. If you have something you want to say, you have to respect the producer that you spoke to and talk to about what topics you were going to cover. But if you have something you need to say or want to say, then, I say it. So yeah, there's that.
There's another anonymous attendee, and I think I'll put this one to you, Damian. Do you have any novel ideas or suggestions, I guess, for media personnel and how to connect with those marginalised people? What can we do as journalists?
The experience of sort of really North Melbourne and Flemington last year was a whole lot of people in uniforms descending on people where there's no existing relationships is really challenging. My honest advice is that, I can talk to the high rises that we work in. We know those people. And so I would advise most not-for-profits now, community organisations like our own, we always want to give voice to our communities. We don't want to speak on behalf of them. We respect their story, their integrity and their own reality. And with the right support and training, and, Emily, I know that you've been involved in interviewing some of the Star Health clients in the past, where that is precisely what has happened. Organisations like our own and many neighbourhood houses, many primary care providers, many GPs know their communities well and can assist in a sense, enabling journalists to access trusted people who can speak authoritatively about their own experience.
Is there something we can take away that the community needs to know now that can help us through the next couple of months? I'm keen to hear something positive.
What's in your shopping basket? Another metaphor. So vaccines are not enough. But if we do vaccines, keep the masks on, we let the kids back to school, so that's the other shopping basket, you're balancing these two. It's going to be the balance of the things that we do going forward. And the good news is that we do know enough to control this virus. With the vaccines and with a certain amount of public health and social measures, hopefully not too much lockdown, or they will still be needed, innovations like ventilation in public buildings, rapid antigen testing, we're going to innovate and we're going to be able to control this virus, and life will not be too bad next year because of that innovation. So that's the sort of messaging I think I'm getting out there. And on the other hand, on the other shopping basket, the one that's weighing you down, we won't be able to do everything immediately. So, it'll be schools first, probably, then more businesses, that sort of thing. That's I think where we're heading now that we've got used to the fact we're starting to live with COVID.
Us maintaining restrictions, it's a social contract that we have with each other and with government. It requires a lot of trust. It requires a lot of communication. And I am concerned that that's fraying. And it's fraying just at the time where we really need it to continue. Because as Tony said, it has to be vaccine plus. We have to do more than just vaccine, or we're just going to be back in some type of lockdown that people aren't going to accept. And there's going to be social unrest, actually, which you're seeing around the world. So I do think that I am concerned about that. That's my main concern, and how we kind of maintain that for the period of time we have to. But one of the things that gives me great optimism is that if we can maintain it, the treatments and the vaccines we have today aren't the treatments and the vaccines we're going to have even in 6 months. So we're going to have new treatments. We're going to have vaccines that are better against Delta, and they're going to be game changers.
Just one final question for everyone, just back on the topic. What do you hope is the legacy of the pandemic in relation to health news or health literacy more generally? Or can you leave us with something that you think has been a positive in this space?
I started with Tudor Hart. I'm going to finish up with another English person, Margaret Thatcher. Let's not diss her totally. She did do some climate change stuff, but she also said that there's no such thing as society, which is obviously incorrect. And what this pandemic has reminded us all, like a world war, is that we function as communities and societies. Infections spread through societies and they have exponential growth and spillover things. So do obesity environments. So does the way that cardiovascular disease risk plays out in society. So does crime and the way that that goes through society, and violence. There's all these things about how we live that are societal phenomena that we can hopefully talk to now in the next 10 to 20 years with greater veracity and with greater cogency for the public, because we can say, remember COVID? Well, we've got a similar thing. It functions at a level, not just with you, but how it functions at the whole societal level. That's what I hope might be a good legacy out of this.
I think what Tony said is really important, but I'm hoping that we save a lot of lives from the flu. The metaphor of COVID like a bad flu is one that I absolutely hate, but something that you've definitely seen through this pandemic is that a lot of people have been spared from respiratory illnesses that they would have gotten severely ill from or even died from. It demonstrates that, just because we've accepted the flu in the past doesn't mean we have to accept people dying of respiratory infectious diseases in the future. And I really hope that, wearing masks when you're sick, doing things like that is something that we preserve, because we can save lives of the elderly, but not just the elderly, of children, of pregnant women, of so many people that don't need to die. We've proven that they don't need to die.
As being part of the primary healthcare network or the primary healthcare system, what really gives me great hope is behind what's happening in the health system, major reforms are happening between the way primary health and acute the hospital sector operate. We're managing COVID clients in community with the help of GPs, triage through organisations like my own, and I think we are on the cusp of a really interesting way of managing chronic disease in community in a way that we haven't been able to do before.